Your body is a complex and incredible machine. It is run by a master control system known as the nervous system. This system is responsible for everything you do, from breathing and thinking to feeling and moving. It is made up of the brain, the spinal cord, and a vast network of nerves that travel to every corner of your body. Think of it like a sophisticated communication network, constantly sending and receiving messages. These messages allow different parts of your body to work together seamlessly, ensuring that everything functions as it should. It is this constant flow of information that keeps you alive, aware, and interacting with the world. Within this intricate network, there is a very special set of nerves. These are called the cranial nerves. Unlike most nerves, which connect to the body through the spinal cord, the cranial nerves emerge directly from the brain and brainstem. This direct connection makes them unique and vitally important. They are the express lanes of your nervous system, primarily serving the head and neck regions. There are 12 pairs of these nerves, each with a specific name, number, and set of tasks. They are essential for our senses, our facial movements, and even some of our basic bodily functions, acting as critical messengers for our daily existence. Imagine your brain as the central command center of a highly advanced headquarters. The cranial nerves are like the most trusted agents who have direct access to the commander-in-chief. They don't need to go through the main switchboard, the spinal cord, to get their orders or deliver their reports. This direct line of communication is crucial for rapid responses and precise control over some of our most important functions. Whether it's the ability to see a beautiful sunset, smell freshly baked cookies, or simply smile at a friend, these nerves are working behind the scenes, making it all possible with incredible efficiency and speed. So, what exactly do these special nerves do? Their jobs are incredibly diverse and sophisticated. They handle the information from 4 of our 5 main senses: sight, smell, hearing, and taste. They also control the muscles that allow us to make facial expressions, chew our food, and move our eyes to follow an object. Furthermore, some cranial nerves have autonomic functions, which means they manage processes that happen automatically, like regulating your heart rate or controlling digestion. They are the unsung heroes of our anatomy, performing a wide array of essential tasks that we often take for granted in our everyday lives. To truly understand the cranial nerves, we need to know where they are located. As their name suggests, these nerves originate within the cranium, which is the part of the skull that encloses the brain. Specifically, 10 of the 12 pairs emerge directly from the brainstem. The brainstem is the stalk-like structure at the base of your brain that connects it to the spinal cord. It is a critical hub for many of your body's most fundamental functions. The 2 remaining pairs, the olfactory and optic nerves, originate from parts of the cerebrum, the largest part of the brain responsible for higher-level thinking and sensory processing. From their points of origin in the brain and brainstem, these 12 pairs of nerves must exit the skull to reach their final destinations. They do this by passing through small openings in the base of the skull called foramina. Each cranial nerve has its own specific pathway and its own designated foramen to travel through. Think of the skull as a protective helmet with carefully designed ports, allowing these vital communication cables to extend outwards. This anatomical arrangement ensures that the delicate nerve fibers are protected by bone as they journey from the central command center to the periphery, where they carry out their important duties. Once outside the skull, the cranial nerves branch out to serve various structures, primarily in the head and neck. For instance, some nerves travel to the eyes, ears, nose, and tongue, carrying sensory information back to the brain. Others innervate the muscles of the face, jaw, and throat, allowing for a wide range of movements. One of these nerves, the vagus nerve, is unique because it travels far beyond the head and neck. It extends down into the chest and abdomen, where it plays a key role in regulating the activity of internal organs like the heart, lungs, and digestive tract. The precise location and pathway of each cranial nerve are incredibly important from a medical standpoint. When a doctor suspects a problem with one of these nerves, knowing its exact route helps them pinpoint where the issue might be. Damage to a cranial nerve can occur anywhere along its path, from its origin in the brain to its final destination. An injury, a tumor, or an infection can compress or damage a nerve as it passes through a narrow foramen in the skull, leading to specific symptoms. This detailed anatomical map is therefore essential for diagnosing and treating neurological conditions affecting these critical pathways. Each of the 12 cranial nerves is identified by a Roman numeral, 1 through 12, and a name that often hints at its function or location. Let's meet these special agents. The first is 1, the olfactory nerve, which is purely for your sense of smell. It's how you detect the aroma of a flower or coffee. Next is 2, the optic nerve, which transmits visual information from your eyes to your brain, allowing you to see the world. 3, the oculomotor nerve, is a primary mover of your eyes. It controls most of the muscles that move your eyeball, lifts your eyelid, and constricts your pupil. Continuing our tour, we find 3 more nerves heavily involved with eye movement and facial sensation. 4, the trochlear nerve also helps move your eyes, specifically allowing you to look down and inward. 5, the trigeminal nerve is the largest cranial nerve and has a dual role. It provides sensation to your face and controls the muscles you use for chewing. Think of the feeling of a breeze on your cheek or the action of biting into an apple. Then comes 6, the abducens nerve, the third nerve dedicated to eye movement, which allows you to look to the side, away from your nose. The second half of the list includes nerves responsible for expression, hearing, balance, and more. 7, the facial nerve, is crucial for facial expressions. It lets you smile, frown, and raise your eyebrows, and it also carries taste sensations from the front of your tongue. 8, the vestibulocochlear nerve has 2 parts, one for hearing, the cochlear, and one for balance, the vestibular. 9, the glossopharyngeal nerve manages taste from the back of the tongue, controls swallowing muscles, and monitors blood pressure. It's a multi-talented nerve essential for both sensation and motor control in the throat region. Finally, we have the last 3 nerves, which have far-reaching and vital functions. 10, the vagus nerve, is the wanderer. It's the longest cranial nerve and influences your heart, lungs, and digestive system, playing a key role in calming your body. 11, the accessory nerve, controls the muscles in your neck and shoulders, allowing you to turn your head and shrug your shoulders. Lastly, 12, the hypoglossal nerve, controls the movement of your tongue, which is essential for speaking clearly and swallowing properly. Together, these 12 nerves orchestrate a huge range of activities that define our daily experience. The importance of the cranial nerves in our daily lives simply cannot be overstated. They are the conductors of a complex symphony that is constantly playing within our bodies. Every moment you are awake, these nerves are hard at work, translating the world around you into a rich tapestry of sensations and enabling you to respond to it. When you enjoy a meal, it's a collaborative effort. The olfactory nerve detects the aroma, the trigeminal nerve controls your chewing, the facial and glossopharyngeal nerves transmit taste, and the hypoglossal nerve moves your tongue to help you swallow. It's a seamless performance that we rarely even think about. Consider the simple act of having a conversation. To listen, your vestibulocochlear nerve is at work. To see the other person's expressions, your optic, oculomotor, trochlear, and abducens nerves coordinate your eye movements. To form a response, your hypoglossal nerve moves your tongue, and your facial nerve helps shape your lips to form words. To show emotion through a smile or a look of concern, your facial nerve is once again called into action. This intricate dance of neural activity happens effortlessly, all thanks to the direct and efficient communication provided by these 12 pairs of nerves. From a health perspective, the cranial nerves serve as critical diagnostic tools for physicians. When a doctor performs a neurological exam, they are often testing the function of these specific nerves. Asking a patient to follow a finger with their eyes, smile, puff out their cheeks, or shrug their shoulders are all simple yet effective ways to assess the integrity of the brainstem and the nerves themselves. Any weakness, loss of sensation, or abnormal movement can provide valuable clues about the location and nature of a neurological problem, such as a stroke, tumor, or degenerative disease. They are windows into the health of the brain. In conclusion, the 12 cranial nerves are fundamental to our human experience. They are the lifelines that connect our brain directly to our senses, our expressions, and many of our vital autonomic functions. They allow us to perceive the beauty of the world, communicate our thoughts and feelings, and sustain the very processes that keep us alive. Understanding their roles not only gives us a deeper appreciation for the marvel of human anatomy, but also highlights their importance in maintaining our health and well-being. They are truly the unsung heroes of our nervous system, working tirelessly to orchestrate the symphony of our daily lives.